Chairman Barrett, Ranking Member Budzinski, Congressman Luttrell, thank you for inviting us to discuss the readiness of VA's EHRM program. In June 2017, the department initiated this program to replace the legacy VISTA system and has since deployed the new EHR to 6 of its medical centers at a cost of about $12.7 billion. The rollout of the system has been met with poor user satisfaction, change management issues, and slow resolution of trouble tickets, among other things. Given the magnitude of user concerns, VA paused deployments in April 2023 to improve the system and address those concerns. On December 2024, VA announced it would resume deployments, starting with 4 Michigan sites in April. By the end of 2026, VA plans to complete another 9 sites under an accelerated deployment schedule, and roughly 170 more throughout the nation by 2031. Over the past 5 years, we've issued 5 reports on VA's efforts to deploy its new EHR system. These reports describe actions taken by the department and identify challenges with key planning tools critical for program oversight. We also reported on challenges experienced with the initial deployments, such as the ones I just noted. To address these challenges, we made 18 recommendations, 12 of which we have marked as priority because of the critical impact they have on strengthening successful future deployments. While VA has taken action to address our recommendations, it has not fully implemented 16 of them. I'll highlight the 12 priority recommendations here. The first 2 are that VA needs to produce an updated cost estimate and schedule. The latest independent cost estimate of roughly $50 billion does not reflect the many changes and delays to the program. And I know you've said that they have provided you with an updated estimate of $37 billion. We have not received that estimate, and so I would ask the department to provide that to us so we can review it. But the updated estimate is imperative to understanding the full magnitude of VA's investment. We have also yet to see an updated integrated master schedule. Consequently, as the department increases its momentum to complete 170 total site deployments by 2031, more information critical to controlling risks and informing congressional oversight is needed. Additionally, more work is needed to demonstrate results of VA's actions to address user concerns and system issues. In May 2023, we reported on gaps in VA's organizational change management activities for EHRM. We also reported that users expressed great dissatisfaction with the new system and that VA did not adequately identify and address those issues. We made 10 priority recommendations to address change management, user satisfaction, system trouble tickets, and independent operational assessment deficiencies. VA concurred with those recommendations. And as of December 2025, VA has partially implemented 1 of the 10 priority recommendations and continues to work towards implementing the remaining 9. For example, VA partially implemented the recommendation to address users' barriers to change. To do so, VA developed plans to address user concerns about the new system identified in a strategic review of the program. However, VA has not yet adequately demonstrated that corresponding improvement projects have fully addressed underlying barriers. VA has also not yet approved and implemented a VA-specific change management strategy to formalize how it will improve the readiness of end users to adapt to working in the new EHR system. Further, VA has no plans to conduct an independent operational assessment or an IV&V test to determine whether the system is operationally suitable. Without an IV&V, the department increases the risk of deploying the system prematurely, thereby posing unnecessary risks to patient health and safety. Moving forward, it will be critical for VA to address the 12 priority recommendations along with the other 4 open ones as soon as possible. Until these are fully implemented, future deployments are at risk of prolonging challenges like those experienced in the initial deployments. Doing so will position VA to more effectively deliver a modern health record system our veterans deserve. And that concludes my statement. I look forward to addressing your questions.